Okay, we are now live, but it will just take a minute for people to join.
Introduce them. No, you're the boss.
They're gonna think, oh god, it's those.
That's the Are we live?
We are, but there's no one joined at the moment.
Okay. Will somebody let us know if they can hear us or not?
Oh, one person.
Fantastic. Okay. Can you hear us?
Alright, shall we just start?
We've got 6 people who've joined yet.
So I introduce us.
Yeah.
So welcome to our third live from the Cotswold Birth Centre. My name is Amanda Anderson and I'm the team leader here, and I'm just going to introduce you to some of our midwives. We're going to talk about positions in labour and water birth today. We're all socially distanced, hence why we haven't got our masks on. So I've introduced myself. I'm Amanda.
I'm Stevie. I'm a community midwife here at Chippy. Hello.
I'm Fiona, I'm another midwife, and here's my buddy, Zoe.
Hello, I'm Zoe, also one of the midwives here.
And we're being filmed by our lovely student midwife, Jo.
Hello.
You can't see. So what we thought we'd do is we just start thinking about positions in labour to help your baby get into position to be born. So just going to really look at how a baby positions themselves in the pelvis. So the pelvis, when women are pregnant, because your body's so amazing, you release a hormone called relaxin, which softens all the cartilage in your body and softens all the ligaments. So preparing you for the birth so that your pelvis can actually get bigger for the birth. Hence why a lot of women waddle towards the end of their pregnancy, and hence why some women get pelvic girdle pain because the cartilage is just being a little bit overstretched. So this is kind of like this pelvis, unfortunately, it's lost the tailbone, but for demonstration purposes. The amazing thing about the pelvis is that when women are actually birthing, the sacrum, this part of the pelvis, actually rises up as long as the woman's not sitting on it. So your pelvis has the potential, if you're in a good position, of increasing its capacity by 30%, which is huge. So let's look at the baby. So this baby actually is equivalent of an 8-pound baby. And babies basically, if they're in the best position, they actually go in sideways on the left-hand side. And as the labour, it'd be easier if I was on a cherry. Hope she doesn't end up in the pool.
Do you want to go and get something anyway? Okay.
Well, shall I go there? Okay. Excuses. So if you're in a good position, the baby comes down with the help of gravity and obviously your body, and then turns, and the head is born, and then for the shoulders it turns back, and then it comes through the pelvis. So we try to encourage, in actual fact, if you just go with how your body feels, the most comfortable position for women in labour is in upward positions or over positions. So, and if you look at the pelvis, well, if you were lying or sitting, you haven't got gravity to help you, so the baby has to actually move upwards. Whereas if you're in an upwards or an over position, then you've also got gravity to help you. So research shows that women who are in upright positions during labour have shorter births. And the babies, because they're all different, some babies go in this way, some babies are what we call in back-to-back positions. Now if a baby's in a back-to-back position, the labours tend to be longer because the baby's got more work to do to negotiate through the pelvis. So, okay, who's next?
I was just going to touch on the term back to back. You'll often read kind of lots of horror stories and things, saying it can make labour really, really difficult. Like Amanda said, it can make some labours slightly longer because babies do have to kind of rotate the longer way round. But we always say it's a variation of the norm. So though it's maybe not referred to as the optimal position for a baby to enter the pelvis, it's still perfectly possible to give birth to the baby in that position, and the majority of babies do rotate and do what they need to do, even if it does take them a bit longer. So if anyone uses that phrase or says, oh, I think your baby's in a back-to-back position, it's nothing you need to worry about or panic about. It's just a baby that's decided that's the most comfortable position to go into the pelvis in, and it's doing what it wants to do. Oh yeah.
So Fiona is our pretend pregnant mum, and she's going to demonstrate a few online positions. Like we said before, that women tend to actually get in positions that are comfortable for them.
Yeah.
But sometimes some women need a little bit of guidance. Now the birthing ball is a great tool, because what it does is that if it's the right size, it puts the women's knees lower than their hips. And in so doing, if we just have a quick look at the pelvis again, if you're kind of like sitting with your knees higher than your hips, your hips are going up, the outlet's going up. But if you're sitting with your knees lower than your hips, then your the pelvis is straighter, so it has gravity to help you and the baby to descend. So it's really good in that you can rock, you can bounce, and women quite often find it very comfortable.
It's a comfortable thing to sit on, whether you're in labour or
yeah.
not. Women, you don't have to be in labour to use a ball. You can use it for many months beforehand. We quite often sit on them as we are now.
Yeah, really
Because
good
they're
for
so
your
comfortable.
core. Yeah.
Really good for your core. So Fiona, what
So on land positions, eh?
on land position?
Did you get the mat out?
Yeah.
First?
Yeah.
I don't want to get on the bed yet, so not yet.
We leave the bed till last.
And in fact, we don't use the bed very often, but we use it for when the baby's been born, for mum to have kind of like skin to skin time and to be able to relax, and obviously for feeding, and if the mum needs any suturing, then we use the bed at those points. So we don't actually use the bed that often, really, do we?
And that's another point, you know, depending on where you're giving birth, sometimes the bed might be in the middle of the room when you go in, but you don't need to leave it there. You can make the room your own, so you can move it to one side, so you've got more room to be more mobile and in different positions. So
That's a really good point.
Yeah.
Okay, roll with the ball, please.
there you
Lovely. So, these do get in the way, these buttons. Leaning over a ball is something we often see women do. Leaning over anything, actually. So, we can use these mats because it's a bit nicer on your knees if you want to be on the floor at all. But yeah, leaning over a ball. When people have been labouring on a mat, it is usually here when I've been using it anyway, and it's because so a woman can be close to something else to lean onto a lot of the time. So the bed as well. I'm sorry, but my back to you. Can you hear me speak when I do? No?
Yeah.
You?
Yeah.
And our bed is brilliant because it's really adjustable.
It is. So you can show that in a minute, but leaning over onto the bed is really good as well. And depending on what height it is, also squatting. They're all upright positions, which we know is good for labour. Do you want to show how it goes?
on bed.
Yeah.
And also, like, you can massage if the
Just
mum
what I
wants.
was going to say.
Yeah, sorry.
You're in an ideal
Yeah.
position.
If the mum wants her back massaged, it's a really nice and comfortable thing.
Higher.
So we can
Sometimes you need to give your knees a rest, so standing up rather than kneeling.
Yeah.
It's a great one.
Yeah, standing.
And we work around you as a midwife, so obviously we do have to monitor babies' heart rates and listen in every so often, but we will get into all sorts of weird and wonderful positions to be able to do that. Sometimes we do have to ask you to move slightly, but otherwise we will work around you as to whatever's most comfortable for you. Really. Yeah. So yeah, this is a good one as well.
Do you want to put on a mask and show me how you can support these as a birthing partner?
Louder.
Yeah.
So, so get back on the floor.
Yeah, so obviously like we say, so sometimes we get partners to sit behind on the ball, so you're nice and comfy as well. But yeah, like we were saying, kind of optimal for doing a bit of back massage here, which is always nice. Some women, rather than just massage, just quite like their hips being pressed in like that, and that can help as well.
I've actually got back pain right down the middle.
Oh, she'll tell you. Do a nice massage. or a little bit of shoulder massage as well. So yeah, this can be a really good one as well.
And please always tell us if you don't like being touched, because you might think you like being touched and then you don't. We want to do what you want.
I was just going to say about positions. We're just showing you that what women often just do on their own. This isn't something we tell them to do. Women adopt the position that's actually good for their baby to get into the pelvis and turn and everything. They do it naturally, don't they? It's amazing to watch. So although we are here to suggest things and give you different ideas of positions and stuff like that, should we think it might be helpful or a good idea, we pretty much let women do it and it happens naturally. Some women, me and Lara were talking about it the other week, about how amazing it is when you see women often in the pool who do lunges and stuff. You haven't told them to, but they start doing things like this. And it's often sort of based on one side, and it's probably to do with whether baby's back is or just needs to sort of get around the inside of the pelvis. They just do it naturally. It's great. Sometimes we suggest different positions, certainly maybe just a change of position if we're thinking about people's knees or parts of their body where they've been leaning on and stuff like that. We think it might be a good idea, but apart from that, it's usually up to the woman, and she knows best, to be honest. Can you think of any on land ones that haven't been touched
Before
on?
you get on the bed,
Good old toilet
we're going on the
position.
toilet. We're going to put one of these in just in case the baby's coming. Okay?
You want me to sit there?
So this is a great position.
And often when people get into this position, they don't want to get back up again because it's so comfortable. And this is often one we try maybe when you're at the position where you are fully dilated, but maybe baby's still a little bit high, just got a little bit more work to do to come a bit lower, or perhaps you might have been pushing for a while and we haven't yet seen anything. Sometimes we will suggest trying this because we often do see that it does suddenly improve things, and we can suddenly see the top of a baby's head, so it is a really good one.
You're all right there. Yeah.
Although it feels like the last thing you want to do if you're in the pool to get out and get onto the toilet, it can really, really help things along.
And we won't expect you to be here in the bright light. We do have a nice little night light in the corner. We've got the lights on so you can see what's happening. Is it the light?
Yeah.
Is that looking really dark in there now?
No, it's fine.
Still see it?
Yeah.
So we'll creep in, because every 15 minutes in the first stage we need to be listening into baby in between contractions. Just going to listen into your baby, Fiona. Okay. It's okay now?
If you pick one up now.
I'm just turning it off now, but we would be listening in for a minute or more, and we'd listen in every 15 minutes. If we had any concerns, we might make a decision to listen in a little bit more frequently, either to reassure us or for us to make another decision, whether you're suitable to stay here or be transferred. Then in the second stage of labour, we'd be listening in at least every 5 minutes. Tend to listen in between each contraction if we can. Yeah.
And it's a really good position for women to release their pelvic floor, because sometimes women, they're holding back because they're worried, because when the baby's coming down, the vagina actually has no nerve endings, so what women feel is an intense pressure in their bowels, so they feel that they want to move their bowels, and they're worried, and they think, oh no, I can't move my bowels, but you've just got to let everything open, drop everything down to the basement, and because the toilet, you're used to doing it.
It's
Muscle memory
helpful,
kind of
isn't it?
thing.
Yeah.
People let go and release a bit more. We don't want anyone to hold anything in.
No.
It is.
We're going to talk a bit more about poo later, but we do love poo.
Midwives like poo.
I was also just going to say another partner position. Sometimes women stand with their arms around their partner's neck if you do want that closeness with your partner as well. And that's a quite good one. You can demonstrate also. So it tends to work a bit better if partners are taller, but it means you can also just sort of rock your hips and you've got a bit of extra support there as well. So yeah, that's also a good one too. Yeah.
Before we move on, is there any questions?
Does anybody have any questions? If you pop them in the chat.
Have they come? There's all sorts.
There's-
Is that just people listening?
That's people tuning in, and we've had some highs and hellos, which has been
Okay.
lovely. And someone has said that you're all looking lovely today, ladies, so that's good.
Okay.
Just wait a couple of seconds because there is a bit of a delay, so it might just take them a moment to hear that we've asked if they've got any questions.
Okay. Shall I move on to what we can do on the bed? And
Yep.
different stuff our beds can do.
Yeah.
Oh, where are you? We're at the Cotswold Birth Centre in Chipping Norton.
Is this the Woodstock room?
Yes, good stop.
This is the Woodstock room.
With the trees.
The bluebell wood.
Yeah. Do you want me to bring it down again?
Yeah.
Oh,
I usually a bit lower when we've been first climb on.
One of our lecturers, Jade's watching. Hi, Jade.
Okay, so if for some reason a woman doesn't want to get back on the pool, she got out to go to the toilet and maybe does feel a bit pushy, but somebody's saying that she wants to stay on dry land, we may suggest different positions for her. The last thing we would suggest is for a woman to get on her back, and women are so conditioned to think that that is the norm because that's what we see on media, in the media, on TV programmes, films, Friends, that sort of thing. It's not actually what is ideally best for a physiological birth where things need to happen naturally and go with gravity and stuff like that. So getting on the back isn't what we sort of go to. It's really good if women get it out of their heads that that's the norm anyway. So beds can be very helpful, but not for what people often think. So it's more upright positions again. And this bed is great because the back of it goes up and down like this, which means I can adopt a sort of higher up all fours position if need be. It means I can hang off it as well. That can be really helpful when it comes to pushing. Also further down. So I can be more over if I need to rest my arms and stuff like that as well. So whatever the woman wants. We're quite good at reading it, but you can always tell us as well if you need something to change. Side.
Yeah.
Actually, I was going to say, we find the side position quite useful towards the very end of the first stage sometimes, if there's just a little bit of cervix left and you can't stop pushing on it, and we don't want you to. So
Yeah,
being on your side.
I'm going to go on this side just for camera purposes. Yeah.
Yeah.
This can be really helpful. Women get tired, and sometimes they do just need to rest, and this is relaxing your muscles and things. Obviously the surgeons will still come, but in between you can close your eyes. They've still got access to your back, your birthing partners, if you want a massage. And yeah, depending on what's going on inside, if we know or not, if there's a bit of a delay, something we can help with. If there's a bit of cervix on one side, actually going on that side may make the baby's head go towards that side and therefore help to dilate the rest of it and get baby sort of further down in the pelvis. Yes? Yeah.
Use this yet.
We've had a couple of questions, ladies. So Justina says, this is a question about the pool. Is there anything you can do to cushion your knees in the water?
Well,
We used to have little small mats. Oh, it's there. We do have some small little mats.
they're not very good.
They're not great. It's something. It's better than nothing.
No, I do agree.
Yeah.
If it's a pool used in a home birth, in some ways they're better because they actually have an inflatable bottom.
Yeah.
Don't they?
I've used towels before.
Towels, yeah.
Towels? Yeah.
We certainly do care about pressure on parts of women's bodies and stuff, so lots of women adopt in kneeling in the pool, and we are mindful of that. It's a reason to have a little break every now and again and stand up or get out and go to a toilet sort of thing, we do think about that.
Even demonstrating a bit.
Yeah.
And also because the water it makes you able to move so easily, it's easy for women to actually come off their knees, isn't it?
Yeah, it's very buoyant.
Yeah, it makes you much more mobile.
Yeah.
Brilliant. We've got another question from Zoe who says, probably a silly question. Well, number one, no question is ever a silly question. She's asked, what is the best thing to wear? So I'm assuming that's in the pool.
Cool.
It's up to you.
It is up to you.
Yeah.
Some people wear nothing.
Yeah.
Some people wear bikini.
Tankini top.
Yeah. Some people do go in a t-shirt, which is absolutely fine, but often women do find it can get a bit annoying when it gets quite wet and clings to the skin a lot. But for some women, they feel most comfortable in that, and we really don't care.
And some
to
people
be
do
honest.
want to wear their pants.
Yeah.
When they're in the pool, that's fine, but they do eventually have to come up.
Yeah.
And
We do need access
Yeah.
to here,
And-
so not a full swimming costume, basically.
that's not a good idea. And we do allow partners in the pool.
Yeah.
We're still allowing that. We are. But they do need to wear their top.
Yeah,
They're most welcome in the pool.
they are.
Yeah, and that
So-
could be a really nice
It can
bit of support as well.
Yeah.
Yeah, definitely.
Brilliant. We've got another question from Stephanie, and she's asked, is it normal to get cold in the birthing pool? I had this for my first son and it's putting me off another water birth.
Okay. So we do really try and keep a close eye on the temperature of the water. We should check it at least hourly, and we do try and keep it nice and warm. So between about 36.5 and 37.5 degrees. We try and fill the water up quite high, so you are covered as much as possible. So ideally, most women say they are an okay temperature and nice and warm.
And
But
the room is
tell
and it's keeping the room warm
Yeah.
as well.
Yeah.
Yeah, so if your room's warm and the water's warm, you
Yeah.
shouldn't really be getting cold. In fact, most people tend to get too
Yeah.
hot if we're not careful rather than
Yeah.
get too cold.
But again, just tell us,
Yeah.
you know, if you're in the pool and it is a bit cold and you'd like some more warm water, just let us know. We ideally don't like it to go too much
Oh, no.
above 37.5 because that can make you feel a little bit hot and dizzy and isn't so good for babies either. But definitely let us know if the water is getting too cold and we'll top it up.
Okay, another question from Janet, and she's asked, what type of birthing aids do you have to help with positions? I saw a birth ball. Anything else? Thanks. Here we go.
The peanut
Peanut.
that we haven't actually used yet.
Yeah.
Who's going to demonstrate? Sort of.
Well, I hope I can demonstrate. I need women to show me what they do with it naturally, really. But I have seen videos and pictures and things like that. So people on their sides. So either like this, opening up their pelvis at one point, having it between your ankles, opens it slightly differently, where your knees are closer together. I've seen people lean over these as well in videos. Yeah, we need to learn, don't we? We need to see some women do it.
In some areas, I think in the hospital they do have some birthing stools, which it's sort of like a little stool but with a hole cut out for so you're sitting on it, but we can still kind of see what's going on. It kind of works in similar ways to sitting on the toilet, to be honest.
It's one of the things that's on
opening
our
your pelvis up.
wanted list,
Yes,
isn't it?
if you want to purchase one.
We did have an inflatable one, but unfortunately it didn't.
Didn't stay on.
No, it started inflating. So that's one of our.
And we do have a bean bag as well, don't we?
Yeah, we do.
Which again, sometimes people lean over as well. Yeah.
And also the partners can be helpful in, like Zoe and I demonstrated, but the partners can help with positions because sometimes, you know, they can sit behind a woman to support her, you know, obviously hold her up. Partners can.
And also, you're not confined to this room while you're in labour. If you want to go out, even outside, but up and down the corridor here, we've got a really good 2 flights of steps because going up and down the stairs is really good. We won't get you running up and down, but yes, it's quite a good way of getting things moving.
Brilliant. We have a question from Jade, and she says, is this support and guidance the same for the spires too?
Yeah.
Definitely.
Brilliant. And another one, is it safe to have a water birth if I have low blood pressure?
Depending on how though, I suppose if a low blood pressure is normal for you and that's your normal blood pressure you run at and it doesn't usually make you feel unwell, then yes, that should be fine. If at any point we monitor blood pressure throughout labour, so if at any point it is particularly low and falling outside of our normal rounds and you are feeling a little bit dizzy or faint, then yes, we may suggest getting out of the pool for a little bit. So
I mean, I'm just thinking your blood pressure might be low at the moment because it's early on in your pregnancy, which is very normal, and we generally find that it wouldn't be low when you were actually in labour.
Yeah, then you can go up a bit. Yeah.
Brilliant. Okay. Jacqueline has said, I would like to see a demonstration of positions for women with PGP, if possible.
That's where water's really good, isn't
Yes.
it?
Yeah.
It is.
Yeah.
Shall I get in?
Yeah.
Yes, you've been dying to get in.
You can get in the pool.
Can
Okay.
you not watch me while I...
No, of course not.
Don't fill my feet, she said.
Naomi's watching. She says, hello, lovelies. Hi, Naomi. So Jill has asked, just whilst Fiona's getting in the pool, is there any reason I shouldn't aim for a water birth if I'm having a VBAC?
So that's something usually we encourage women to discuss. Well, you may have seen a doctor in pregnancy, you may have seen a consultant midwife. It's kind of individual for each case. So hopefully you'll have a chance to discuss it with one of those people in the pregnancy. If not, and you go into labour, then it will usually kind of just be assessed on a case-by-case basis. Really, so long as we're able to monitor your baby's heart rate throughout labour, it shouldn't be an issue. And there are lots of wireless monitors that do work in water now as well. So so long as we're able to get a good trace, good pick up at the baby's heart rate, and there's no other kind of risk factors, then it should be fine. But we do take each case individually and kind of assess it on the day with a discussion with doctors if it hasn't already been discussed in the pregnancy. But ideally, we get as many women as possible to be able to use the water in labour, definitely. Yeah.
Brilliant. Jacqueline has also asked if not just water positions, but is there anything else?
Say that again.
So Jacqueline originally asked if you...
PGP.
Yes, for PGP. So not just water, if that's okay.
What's a good thing with PGP is if you actually measure how far you can open your legs before it gets painful and then take that measure in. So that, you know, say if, for example, you decided to have an epidural, they then have a measure as to how far that you can open your legs without it being, causing you pain, because obviously they don't want to damage you. PGP, you have to be guided by your body. Paul is great.
Because you tend not to be opening your legs quite wide, which is often what exacerbates PGP and makes it more painful. So this is good because you can keep your legs relatively close together, but you are still opening your pelvis up by being upright in this position. So bulls are often really good. Equally, like with the sitting on the toilet position or sitting on a birth stool. So yeah, these really upright positions which don't involve you opening your legs particularly wide, like some of the more leaning forwards positions. They can involve opening your legs up a little bit wider, so these ones tend to be quite good for those women, yeah. Or the line on the side as well, yeah. There's really any positions where you're minimising that movement like that with your legs, really, yeah.
Brilliant. Thank you.
But yeah, definitely water as well.
Yeah.
It makes you feel sort of weightless, good for your joints and everything. You can move around really freely. It's semi-better than because you're in control of it. You can feel what hurts or when you're overextending, which you wouldn't be able to do with an epidural. So then, yes, you have got to have faith in the people looking after you, because you might be more numb to it, if that makes sense. So actually, water would be a really good thing to help with the pain, but also keep you in control of what you can feel and everything. We know water, the research shows that you're less likely to have any other pain relief if you go for water, including epidurals. So yeah, I'm in here. It is it's really nice.
Have you been there before?
Not in this one. Who said that? Yeah. No, I haven't. It's 36.7 degrees in
How
here.
does it feel?
Absolutely lovely. Really, really nice. Women just naturally get into the positions they want to in here. We don't guide them. I would say most of the time they still go into a leaning forward position, do not. So usually leaning forward over a side. Down.
Yeah. Stop you to lean on. Yeah.
There's a stool here. We make the partner comfortable.
Yeah. This is in the way at the moment. Yeah. So partners are very much involved, well, as involved as they want to be, and the woman wants them to be in labour. But we do really encourage you to be able to be sitting close together. And we sit quietly in the background. Really.
Yeah, we'll try and get it out of the way.
Yeah.
So a lot of women usually tend to slump over the side and use the side of the pool as a support, where partners will often automatically sort of rub them, stroke their hair, offer them drinks and things like that, or you might be really lucky and get a steamy head massage if you go in the right way.
Slap you around the face with a cold flannel. Pat you around the face with a cold flannel.
There's handles here, which some people use, and some women naturally get into a squatting position. I don't know if you can see that, but I'm squatting.
Can now, yeah.
Yeah, so it's another upright position. You can use the handles to go around in circles and move your hips in different directions. And some women do lean more, often using the other side of the pool with their feet. Do you find?
Yeah.
Sort of stay stable, but often still moving around. Women just do it naturally.
I've had women submerge themselves in the pool right to the top of their head.
Oh yeah.
End up very wet through. That's
Yeah.
fine as well. We get water all over the place. That's okay.
We do.
You can sort of lie on your side and as well.
Yeah.
Some people find that very comfortable.
Yeah, you can. There is a seat here. It's not often. Most people don't really sit on it. You're not in it enough.
It's more for getting in and out.
Yeah. But it is there, should you want to use it. We want you to be, your tummy to be completely under the water to get the full effect of the warmth from the water for pain relief. So yeah, we'll often try and get you to get in properly.
I know we're talking positions, but we haven't talked about when you get in the pool.
Okay. You can do that.
When
Right.
do you get in the pool? We don't always know when's suitable time to get in the pool.
And we use it as a form of pain relief. We don't encourage you. Well, you can use baths and everything at home in the early phases of labour, but when you're in established labour and you're feeling that you need something more, that's the time to use it. We don't just use it just let's just go and relax. We use it actually as a tool to help women, cope with the surges. And in fact, if you get in too early, it doesn't matter, but what tends to happen is that your labour slows down, so all we do is we get you out. If you're in really good, strong labour, we tend to find that when women get in and they just go, oh, and actually their labour quite often accelerates because everything's just relaxed, so it is quite key getting in at the right time. But it's about talking with the midwife, saying how you're feeling a bit, your midwife will discuss if it's the right time, but really we're guided by you, to be absolutely honest with you, but we would always discuss with you that if we felt that you weren't really established, it would be probably best not to go in at that point. But if you needed to, just to get a break, then yeah, water is great in early labour also, because it gives you a bit of a break from it. So yeah,
I'm just going to say, don't feel any pressure to get in the pool. It isn't for everybody, and some people do not want to get in the pool, and that's absolutely fine. Some people actually don't make it into the pool because we haven't got it filled up, or they get here and have a baby so quickly.
Yeah. Also give it a chance. You might not think you like it, but
I think it's rare you come across a woman who gets in and says, no, this isn't for me, I'm going to get out. Some people don't want to actually give birth in the pool, they just want to use it as a coping mechanism throughout labour, but actually get back out onto dry land for the birth, and that's also fine. Again, we often do find that might be something planned, but when they're in there, they actually finding it so helpful that they decide they want to stay in for the birth as well.
Yeah.
And some people just know that they want to do the whole thing in the pool, but it really is up to you what you want to do. Yeah.
Can you turn the light off so they can see how nice it looks with the light on? And
Is that showing?
does that
Yeah, looks
does it look
lovely.
good?
Yeah.
And another good thing about the pool is that because you're quite contained, it feels quite cosy.
It's like a nest.
It's like a nest. It's like your own private, safe space. I think lots of women feel that they feel very safe and in control because they are in a sort of more contained space as well. So that definitely helps too.
Yeah. It's their little area where we have to ask permission to enter. So coming to that, we still listen to baby as often as
That's
we
just what I was
would.
going to say. So they're waterproof, are solid.
Yeah.
So listening can make a bit of a weird noise.
Don't do that screechy thing. We still want a woman to feel as undisturbed as possible, so we will try and sort of work our way around her. The things, the positions.
But always
we get
in the
to
pool
do
with
this.
you.
Yeah. So as I said, a lot of women are leaning over, in which case it's more than.
That's a horrible noise it makes. I've got the sound on.
She's very it's not that
Hey.
lovely.
So Sam's asked a question about the pool. She said, do you need to get out for examinations?
Yes. Yeah.
It's virtually impossible to do a vaginal examination in the pool.
But does she mean logistically? Yes. But does she have to get out to have them? No.
No.
They're not.
Decline.
It's not something that has to happen. Dead on the timing where it's suggested. Every case is different, and we will offer them if we think it's a good idea. But many people have babies without that ever happening. But yeah, you can't do a good job of it in the pool, no. If we thought it was a good idea and you agreed to having an examination, I would always get somebody out and onto the bed if they could manage that. Do you agree?
Yes.
Yeah. We've got a question from Kate who says, how does being in the pool affect Peach's protocol?
Sure.
Is it still possible in the water?
So, for other people watching that aren't sure what PEACHES is our acronym, and it stands for lots of different things, and it's to do with how we can best support a woman's perineum at the point of birth in order to hopefully minimise any tearing. So the first thing to know is that there hasn't been any research that shows that women are more likely to tear or sustain worse tears if they give birth in water, so that's really important to remember. There's no research that shows that. We are, however, not hands-on when people have a water birth, so when you're out of the pool, we can talk about that a bit later, but our policy does tend to be recommending a bit more hands-on to protect the perineum. But what we often find is just that because the water's warm, that does encourage blood flow to the perineum and encourages it to stretch more as well. So that the warmth of the water does help. And we are watching, we have little mirrors which we can show you as well. So we are watching every step of the way. We are guiding you when we can see the baby's head, guiding you as to how best to control that and when to breathe rather than to push. So we aim for it to be a really calm and slow birth of your baby in order to minimise tearing. So it's perfectly safe, really, is a thing to remember. Otherwise, we wouldn't recommend it if we thought there was research that showed women are more likely to sustain tears in the pool. If at any point we are worried that you might sustain a tear, but very rarely, sometimes from what we can see, that might be more likely to happen, and we may suggest getting out of the pool, but that really doesn't happen very often. Yeah.
Okay. Brilliant, thank you. Georgina says, I have high blood pressure and I'm on Lebatolol, I can't pronounce it, Libby's, thank you. I'm planning to give birth on the delivery suite. Would I still be able to spend time in the pool? And also, at what point would they induce me due to high BP?
So again, this is one of those things that's very much an individual case-by-case basis, and that's why women with raised blood pressure do tend to be under consultant care as well as seeing a midwife, so that doctors are involved in those decisions. It depends how well controlled your blood pressure is as to whether we feel it's safe for you to get in the pool, really. And again, that it would be a conversation that probably needs to be had between yourself and the midwife and the doctors working that day. But equally, remember, you do have a choice in everything, and although it may not be recommended if you felt really strongly about it, it is up to you to make an informed decision. So there's no such thing as not being allowed to do anything in labour and birth. You are allowed to do what you want, so long as you understood the risks and benefits of things. So it's certainly, still an option available. It would just be a conversation to be had on the day, really, and depending on how well your blood pressure be controlled. Induction as well, we wouldn't be able to say without having been involved in your care with your pregnancy specifically, and again, that is a doctor's decision, really. It's depending on how well controlled your blood pressure is.
Brilliant. Stephanie's asked, do partners need to wear masks the whole time they're with you? And Jada said, and do we need to wear masks?
So women definitely don't need to wear masks. We do encourage partners to wear a mask when there is also a healthcare professional in the room, if they feel comfortable doing so. Obviously, when we may pop in and out of the room very briefly, they can take it off and have some time without it. We appreciate they're not the nicest of things to wear, but yes, that is our policy as a trust at the moment, that partners and anyone visiting wears a mask if they're happy to.
Brilliant. And Charlotte's just sent you a little message, Zoe, to say that you're an amazing midwife and that you gave her so much support and information when she was pregnant and supported her after Alicia was born. So thank you so much. That's lovely. There's one more question and then we can move on. If you have injections to thin blood prior to birth, can this affect your choice of birth plans, e.g. pools?
As far as I know, no.
No.
No, I don't believe so.
Okay, brilliant.
Okay.
Yeah.
Is that let's see, what time are we?
We are 3:10.
Just gone 10
All right.
past 3.
What else would you like to cover?
So is that
So we've not had a baby yet.
No, we haven't.
I'm just going to show you 2 vital pieces, well 3 actually, vital pieces of equipment down here. A sieve. Anybody know what the sieve's for?
I
We talked about poo earlier. I think it's one of women's worst fears of pooing when they're in labour. And what do we say, Fiona?
We love poo. When I see poo, I'm excited. I know a baby's probably not far away. So we're really good at getting rid of it before you even know it's there, don't we?
Generally, this is a single-use sieve. We don't use them again. We don't sterilise them or anything. They go in the bin. So it's used to scoop out the poo, put it in one of the little cardboard pots. So you usually know that you're pooing, but you don't tend to see an awful lot of it.
And in fact, a lot of women, it's always usually only very little amount, if any, because during your labour or when you're about to go into labour, your body quite often empties itself out anyway. So if there is some, it's not a lot.
When you're in second stage of labour and you're pushing, we do like to keep an eye on your perineum, what's happening, and watch out for what we call external signs, because we do notice your anus actually opening and your vulva starting to part. So we have this, and generally when women are in the pool, they're in the forward position, like Fiona's just demonstrated. So we have this amazing mirror. It's called the Howe's mirror, because it's invented by a midwife called Virginia Howe. And we have a torch, because we hold it underneath. What we're going to see is a pair of black pants. And we shine the torch.
Don't want me to take them off.
But if we shine the torch on the mirror, she's having a baby.
This is amazing.
Catch your own baby because you're doing really well. You just breathe that baby out nice and slowly. That's amazing. We've got a whole head here.
Oh, that was just jumping in.
Go on.
It's very normal for there to be a pause between baby's head being born and then waiting
see
for
the
the
head?
next
I can see the head,
for
yeah.
the next
Can I see it?
surge. So often, sometimes women
Go.
panic and they think their baby's stuck and why isn't the baby coming, but that's very, very normal. And it can feel like a really long wait, that part, but it can be sort of 2 or 3 minutes between head people.
Get off! There's the baby!
Also, it's sensible now. So we've had one contraction and the head's poor. So we're going to have a baby now.
Okay.
You're going to catch your own baby, Fiona.
Of course I am.
Of course you are. Just going to guide this, but right, okay. There you go.
Oh, congratulations.
Lovely.
I did it!
And then this time is still a nice, calm and peaceful time. We don't rush to get you out of the pool. You can enjoy those cuddles in there. So yeah, it's a nice, calm, relaxing time. Some women, depending on how you're choosing to give birth to your placenta, if you're choosing to have what we call the actively managed delivery of the placenta, we do need to get you out of the pool for that. But if you want it to come naturally, we can deliver it in the pool. If you don't want to get out, everyone's different.
We don't ask you to walk to the pool. Ooh.
Well, other important things, I suppose, at the actual point of birth, if you're having a water birth, it's very important your whole bottom is under the water. So what causes babies to breathe, start breathing on their own, partly it's the temperature change, so when they come out of the water into the cold air, it stimulates them to be able to breathe. So we don't want you kind of half out, half in. We want them to be born into the warm water, and then when you lift them up, they take their breath.
Do you mind recording me from that angle?
I can record you from that angle.
Is this that the mask? So some women, we really try and promote delayed cord clamping, so leaving the cord intact. So some women prefer it to be cut before they get out of the pool, but where possible, we do encourage you to stay together and support you to stand. To get out of the pool.
We get partners to help us at this point as well.
So often I sort of use the handles.
Right towel on that baby.
And then
Drop that towel out of the way. There you go. Well done. And then just crawl up the bed. Oh, somebody's going to have to make this bed now. Oops.
there we go. And then I'll make it nice and warm. Pop some more towels, big blanket.
Put it back in the corner.
If you want some skin to skin, if you haven't already, if you've still got a bikini top on, if you want to help you take that off.
How are you feeling, Fiona? That was a nice short labour, wasn't it?
I'm going to have words with you about that bubbles.
We've got a couple of questions. Okay, yeah, so Jessica has asked, if you want anti-sickness injection for a home birth, how do you arrange? The doctor said it has to come from the midwife's budget and I can't order it.
We bring the drugs out. So yes, it should be part of the home birth kit. So yeah, shouldn't have to worry about that.
Okay, Justina has asked, what positions would you recommend for getting through transition?
Well, exactly the same ones, really. Often, so if people aren't aware, the transitional stage of labour, it's often sort of just before you're fully dilated, just before you're at that second stage of labour. And one of the things we often see with the transitional stage is that women can suddenly feel quite panicky. And that's because your body's actually doing a very clever thing of giving you a sudden surge of adrenaline. So you've got the energy to be able to get through that last second stage of labour, the pushing phase, but obviously adrenaline does sort of counteract oxytocin, so it can suddenly make you feel quite panicky. I often hear people say, can't do it anymore, I want an epidural, all of that kind of stuff. So I suppose really positions that make you feel quite grounded and in control, really. So often again, we bang on about the pool, but the pool can be good because you feel secure and safe, which helps if you feel a bit panicky. Being upright definitely helps in the transitional stage as well, because we do know from research when women are lying down, they can feel less in control, particularly if the people providing care are sort of above them and leaning over them. So anything that makes you feel quite grounded and in control, really, and that will be different for each woman, I would say. But really, the same principle apply, so trying to stay as upright as possible, really. Yeah.
Brilliant. Anything to add, anyone?
No.
Okay. So Carly has asked, sorry if this has been asked already, but do all rooms have pools? I'll probably be either at the Spires or the Horton.
So in the Spires, I think there's three. There's three pools. Three pools in the yeah, that's right. 3 pools in the Spires. The Horton have 1 pool.
We have 2.
Yeah, we have 2.
And 1 delivery
And there's
suite.
1 on labour ward.
Yeah. So yeah, in most maternity-led, midwifery-led units, most of the rooms will have pools. If you're on delivery suite, the John Radcliffe, then only 1 of them has a pool.
Okay, great, thank you. Stephanie has said, I would like to give birth at the Spires, but I'm interested in going to a local midwife-led centre in early labour, for example, Wallingford, so they can check my progress, as I suffered a failure to progress during the first labour. Is that okay?
Usually, if you're choosing to have your baby, at the Spires, because you'll be under their care. Usually, women go to the actual place where they're going to have their baby. If it's during the day, and you can phone at Wallingford, and I'm sure that they would see you. But at night, if you're not planning to have your baby at Wallingford, then obviously to call a midwife out. They don't usually, at this present time, offer that facility. There is talk in the future of the community midwives, the community midwives doing that, but that kind of with all the COVID and everything, that kind of has been put on the back burner at the moment. So hopefully the future, but definitely during the day, Wallingford, I'm sure would facilitate that for you. Do you agree with that?
I do.
Yeah.
Well, we would do that here
Yeah.
as well. Somebody who's choosing to birth at another hospital
Wants a bit of an assessment.
wants an assessment, because it is quite a long drive to Oxford. But it would be just during the day. We wouldn't. We can't be called out for that if you're not birthing with us.
Also, it's a shame that it's worrying you about your future birth because you've heard the words failure to progress.
Horrible words.
They are horrible words, and it does not mean your body failed at all. Things could have been done differently, perhaps. Who knows? But I hope you feel really supported, and speak to your midwife about that, because you need to get those words out of your head. All right.
Good, I think that's it for the questions.
Okay. All right. Anything else anybody's got to add? Just kind of just touching on things like if you do decide to have your baby in the pool, you can use aromatherapy. You can use the gas and air in the pool.
Just talking about pain relief, the only thing that does affect using the pool is if you were to opt to have one of the opiate options of pain relief, which is either Meptid or diamorphine. And our guidelines do suggest if you have opted to have one of those methods, ideally you should get out the pool to have it and stay out for around 2 hours before getting back in. And the reason for that is that it can make some women feel a little faint and dizzy. Most people are fine with it, but it can make some women feel like that. It's not ideal if you were to faint in the pool. So that's the rationale for that. So that's the only kind of pain relief that would affect you being in the pool, and an epidural, obviously.
Yes, if there are any other questions?
What about
They're talking about the injections and the water injections.
I think Wendy did it. We were just talking about
We've all been trained.
Yeah,
now,
we've been
haven't we,
trained.
to use
We're
it?
really excited about, I don't know if anybody's heard of the sterile water injections that can be used for relief of back pain, which is, we're all just very newly trained. It's very easy to do. But yeah, that's an option if you have got back pain that we can do.
We can do it here.
Yeah, and at home births. Yeah, so yeah.
Great. I've had lots of lovely comments saying that this session has been really helpful.
Oh, thank you.
Great. So if there's no further questions, Fiona's gone to get changed. So goodbye
She's
to
got
Fiona.
off actually. She's going to see one of her mums on her way home.
So we're going to say bye from the Cotswold Birth Centre. So thank you for joining
Thank you
us.
for joining us.
Yeah.
Bye-bye.
Bye.
Bye.
And thank you, Joe, for filming.
Pleasure. Absolute pleasure. I'm going to press finish now.